you might have. You may have other examples of evidence within your organization that you use that I did not put up here. Once you, of course, do question 1, then you're going to go to, of course, question 1 is the setting is integrated and supports a full access to the community. You'll go to the second question. The setting is selected from an array of options that are non-disability specific. Ensures the right to privacy, dignity, respect, and freedom of choice from coercion and restraint. Optimizes independent initiative, autonomy, choice-making activities, and environments. Facilitates choice regarding services, supports, and providers. And just want to say that if you're currently using the support plan format that's on our website, a lot of this information should be gone over at the person's team meeting in the profile section of the plan. For section 2, it's the same. This is residential specific, so the first is for everybody, and second is only for those providing residential services. If you do not provide residential services and you completed section 1, what you will need to do, so for example, if all you do is day services or day experiential services, then what you will do for each question is mark no, and in the box for comments, all you need to put is NA, okay? And that's when you're entering the information into the Adidas section, which we're going to talk about later on, okay? For everybody else that provides residential services, you're going to do the same. You're going to read each question, look at the probing questions, and decide if the particular site, your preponderance of evidence, meets that question or not. If it does, then you're going to list the evidence. Again, I've listed some potential examples. And if not, then you're going to explain why. The questions are: property can be rented, owned, or occupied under tenant law, or as there is a lease agreement with the provider for each participant. Units are lockable by the individual and only necessary staff have keys. Individuals sharing units have a choice of roommates in the setting. Individuals are free to furnish and decorate sleeping and living environments. Individuals are free and supported to control their own schedules and activities. And individuals are free to have visitors of their choosing at any time. The setting is physically accessible to the individual. And number 8, what we're looking at here is if there are some type of restrictions related to numbers 1 through 7, then what we need to make sure is that the following items that are the probing questions can be answered in the affirmative under that. So if there's some type of a restriction, we need to make sure that it is listed in the individualized assessment, that positive interventions and supports used prior to the modification are identified, less restrictive methods of meeting the needs that have been tried and did not work, a clear description of the condition that is directly proportionate to the modification. And I know that one's a bit confusing, but for example, if I get a speeding ticket on my way to work, then I don't automatically lose my car. I would get a ticket, I might get a warning. If I keep messing up, then I might eventually lose my license, but they don't take my car. So it's supposed to be relative to the problem that's being manifested. There also needs to be an indication of the data to be collected to measure the effectiveness of the modification. It needs to have established timelines for review. Informed consent of the individual or legally authorized representative needs to be present, and assurances that the intervention and supports do not cause harm. And really, this goes right down our basic assurances survey in terms of rights and exercising rights, and also positive services and support. So I'm hopeful that most of you are following all of these guidelines for any restrictions that are necessary for people that you support in your organization. And just let me say that for Sections 1 and Sections 2, these are not items that we came up with to decide whether we're meeting the rule or not. This comes right out of CMS's regulations to the states. And what we've done with the probing questions is we've tried to pull probing questions from the basic assurances system. So you might recognize, if you're actually doing a self-assessment of your agency prior to your certification on the basic assurances, a lot of these questions, the probing questions, come right out of that manual. Moving on to Section 3, settings that are not home and community-based. If any of these are answered yes, then that means that the setting is not in compliance with the HCBS rule. And they are, is the setting a skilled nursing setting, such as a nursing home? Is the setting an institution or ICF, which we have, I think, 1 or 2 private ICFs out there? Is the setting a hospital? And does the setting otherwise have qualities of an institutional setting? So, for example, does the setting isolate individuals from the broader community? In our conversations with CMS, what they have indicated to us is that the size of the setting does not necessarily make or break whether you're in compliance with the rule, but what their expectation is that regardless of the number of people in a particular setting, that it maximizes people's access to the broader community, access to interactions and events and activities and so forth that are not disability specific, so that anybody in the community could attend. After you finish this, we would ask that you make some recommendations for the particular site. And again, we have to complete one of these on every site. And what we would ask then for that particular site, if you have areas that are determined to be non-compliant, then we would request that you make a recommendation as to what you might do to make the particular question in compliance. Finally, you're going to sign it and you're going to date it, and then all of these will then need to be forwarded to the community service office in your area, and that will be by the 15th of October. The Community Service Office will then look at all the information. We'll be taking a look at whether we have questions about whether the setting is actually in compliance or not. And then if we do have questions, then the plan is to have a team in each region made up of stakeholders, probably individuals, families, somebody from the Regional Community Service Office, then to go out and take a look at those sites that we have questions about in person. The other important piece of this, and it's on our website, and it's a webinar for entering this information into Adidas, and you will need to go to that website and click on it, and Deborah Moloch, who is our functional analyst here, has put this together, and she actually talks you through in sort of a demonstration mode of exactly how to get into the Adidas, how to access the assessment, and how to enter the information. And again, we'll need to enter each assessment for each site into Adidas, and then that will allow us to do the analysis that we have to do to submit to CMS. Daphne, you have anything else?
We haven't had any questions. I think it'd be a good time.
We have not had any questions, so if anybody has any questions, it would be a good time to, again, go down to the notes section, select all on the drop-down, type in your question in the little section provided, and then hit send, and we'll try to respond to any questions that you have. While we're waiting, I'll just also say that this is being recorded, so as always, I think some people have had some snags in being able to attend with us today, or some technical difficulties so that they couldn't join in. But this is going to be recorded and will also be available on our website as well. So if you talk to people and they say, well, we weren't able to attend, it will be on the website. While we continue to wait for questions, I'll just say I know this is a lot of work and all at once, and you know, we've been working really hard to try and get this done and completed with all of our stakeholder input. And you know, we had to get it done quickly because of CMS and because of our waiver renewal as well. So again, we didn't sit around and just try to make up something to keep you guys busy, because I know you all have plenty to do, but this is something we've got to do and submit in order to get our waiver renewed. Okay, still haven't gotten any questions, so now's the time. Okay, well, if there aren't any questions right now, and I'm sure you will think of some later on, if you would, wait, we have one question.
site or just overall assessment for the program, each site?
The question is, would we do an assessment for if an agency had, say, for example, 2 day programs and 4 houses? Would you just do it on residential and just do it on day? And the answer is no. We have to do an assessment on each specific site that is operated by the organization. We have another question.
Your subcontractor, does your case manager put information into the data for you? If you're a subcontractor, meaning you don't have a user license, I would expect that the contractor would put this in.
Okay. The question was, is if you're a subcontractor and you don't have a license to Adidas, then it's whoever your contractor is would be responsible for getting that information into Adidas.
Right now, our case management agents aren't involved.
Unless the case manager is the contractor. If the case management agency just does case management, then they're not included in this process at this time. So I guess that's to say that if you're subcontracting with your case management agency, then yes, they would be the ones to put the information into Adidas for you. Another question? I've still got the assessment up. See which one I click on. Hold on just one moment. We're having a little technical difficulty on our end. There's a question that's out there, but we can't see it for some reason.
The assessment sent to the regional office and entered into the Adidas by the agency. Do the agency director sign the assessment or the person completing it?
Okay, the question is the assessment sent to the regional office and entered into Adidas by the agency? Yes. Does the agency director sign the assessment or the person completing? We're only requesting that the person completing the assessment sign it, but that can be left up to each individual agency how they want to do that. How specific should we get in the evidence section? For example, if evidence by a policy, do we put the policy number, etc.? You know, if it's covered by a particular policy in your agency, just list that policy. You don't have to have the number, and you don't have to describe it or anything. Just list the policy. What if you contract directly with the department and do not have access to Adidas?
Well, if you're a direct contractor in billing, you should have a license, but if not, send Charlene Weldon, get up with her and she can add a user license, but I think it's unusual for a contractor that bills through the system to not have a user license.
Will the question and answers be listed on the website along with this presentation? The questions, the checklist, if I'm understanding you, the checklist, the blank checklist and the checklist with examples are currently on the website under ADMH, and then you go to Developmental Disabilities and to Community Programs. Once all of this activity is completed, then we will be doing an analysis and we'll be doing a final report. That's going to be due by November the 21st, and that will be made available in public. Would the provider contact Deborah Moloch directly for instructions on how to complete the assessment in Adidas? There is a specific webinar that is also on our website, and I think it's called Webinar for Home and Community-Based Assessment. And if you'll view that, she actually walks you through how to enter the assessment in Adidas. How does CMS define regular community integration, daily, multiple, weekly, very unclear as to how to assess with no discrete definition? You know, if you think about it, if you've been through personal outcome measures, or if you've been training, or you look at the basic assurances, that's one of those indicators that we call type and frequency. So regular really would be defined by the person. So what they would want to do and how often that they would want to do it. And I know that that has to be within reason. And I know that also some folks have some startling hobbies that may not be they may not be as able to go into public settings and other community settings as much as we would like them to, but we also don't want to shock our community with some of the things that that people do. So regular is really, you know, defined by the person, but and again, just, you know, thinking about yourself, what you regularly do in the community for a week. Now, I know all of us have jobs, and we probably go home and lock the door in the evening, don't go out much, but, you know, what do we do on the weekends, and do we have to run to the grocery store, and do we have to run by the cleaners, and those kind of things. With the personal outcome measures questions, do the case managers answer those, or does the provider Q answer those? The POM on the example list is basically an example of some evidence that you might have. So if you're currently using the POMs with the folks that you serve, and doing so prior to the meeting. That's what I was talking about in terms of the Plm questions. I'm not asking that you go out and complete one on personal outcome measures interview on everybody. It's just that if you've been doing that, that might be a place where you can get some additional ideas about evidence as to whether the question is in compliance or not. Is an assessment sent to regional office and entered into Adidas by the agency? I think this is a repeat. Does the agency director sign the assessment? And we've already talked about that. Let me see if I have any newer questions. Here's the question. There will be one assessment for one-day program, correct? And the answer is yes. So for each day program that you operate, there would be one assessment. If there are 30 residential locations, then there would be 30 assessments completed, and that is correct. Again, one for each site.
We are really not looking to give additional user license.
The question is, can we get new logins for Adidas for the clinical staff entering data?
We're really not looking to expand. Everybody should have at least one, if not two. If you have a large number of sites that's requiring that you use additional staff, you can send that request to the regional office. The regional office can send it to Charlene Weldon, but we're not encouraging a lot of additional user license because we'll have to turn around and activate them after the work's been completed.
Okay, that answers all the questions that were presented. So if there are no more questions, then that's going to complete this piece of the training. Again, if you have additional questions that you think of as if you are providing hourly in-home supports, would you complete one assessment for each region? We got another question. If you're we're not doing assessments for hourly services for this exercise, just residential and day. Now, if you're providing, well, just residential and day.
And the day, examples of day,
Okay, any other questions? Again, if you think of any questions after we end today, I would appreciate it if you would start with your regional community service office first, and if there's something that they can't answer or they need to discuss with me, then they can call me and we'll get an answer to you. But if you would, please just contact the community service office first. Okay, again, if there's no more questions, then there is the webinar on the website that will teach you how to enter the information into Adidas. And this this training should be posted on the website shortly after we conclude today. And again, if you have any questions, please contact your Regional Community Service Office first, and we'll go from there. Again, I appreciate all that you guys do, and I appreciate your hard work. And this will help us greatly in terms of getting our waiver renewed and being able to continue to provide services for everyone. So with that, I hope all of you guys have a good day, and we'll be talking to you soon. Bye.